Okay, let's do that. Well, my name again is Dan Rakonda. Thank you, Salma, for that kind introduction. I am the program director for the Baylor College of Medicine Genetic Counseling Program, and it is my privilege and honor to give you an introduction to what we have to offer here at Baylor. And the inevitable question that any applicant is going to ask us is, why Baylor College of Medicine? So to answer that question, one of the things that certainly differentiates our program from many other programs is that we exist in the largest medical center in the world here at the TMC, the Texas Medical Center, with 15 plus renowned hospitals, 2 specialty hospitals, medical schools, nursing schools. The remarkable conflagration of all of these institutions allow for roughly 10 million patient encounters per year, over 9,000 patient beds, and currently there is about $3 billion in construction, including the new educational campus that we will be moving into in 2026 for the brand new educational facilities that are currently under construction. A couple of other notable relevant factors regarding our program: over the past 11 years now, the Department of Molecular and Human Genetics has been the #1 funded NIH grant funded for genetics related research, #1 molecular and human genetics program within the US, one of the largest and best in the world. We have the largest clinical genetics program in the country, and we are also affiliated with the Baylor Genetics Lab, which was one of the founding laboratories for the Human Genome Project, completed earlier in the 21st century. So it would be helpful, I'm sure, for us to go over curriculum, and I'll run through the courses briefly. In the fall of year 1, we offer 15.5 credits of coursework, including the Foundations of Genetic Counseling, which I have the honor and privilege of teaching. That's 2 2-hour classes per week. And as the title suggests, it is the foundational review of concepts related to the practice of genetic counseling. We also have a 2-semester course, the first of which is MedGen 1. That is 3 credits. It's sort of a flipped classroom hybrid approach where there's live lectures that alternate with videotaped lectures on Mondays. And then on Wednesdays, there is the hands-on application of what may have been learned earlier with genetic counselor students in the Wednesday class, but there's also residents and fellows, and that's what the asterisk refers to when you see that next to a course, is those are other learners that are joining the genetic counseling learners as well. That also proves to be one of the most important courses, the MedGen course, in giving you the foundations of medical genetics and the different areas in which being familiar with various conditions, cytogenetics, biochemical disorders, prenatal, pediatric, it gives you a good breadth and depth of medical genetics in general. Also, a course taught by Salma Nassef, our Associate Program Director. The embryology course is a 1-credit course in the fall that gives you the foundational understanding of the developmental process of the human and the embryo, if you will, and what that means with regard to disorders of genetics and non-genetic nature. The health behavioral counseling course taught by Beth Garland is a motivational interview, psychological counseling practice tools, if you will, which has role play. So does Foundations have role play related components, and there's standardized patient encounters in both the Foundations and health behavioral counseling course. In preparing for genetic counseling, it marries well with what's learned in the Foundations course with more hands-on application. Salma Nassef is the director for that course in preparing for genetic counseling. And then there's research methods in genetic counseling. Rachel Franciscovich and Sarah Scullen are the co-directors for that course, where they're introducing you to research methodology and allowing you to get the basic information you'll need for what will eventually be your thesis project as we go through additional components of the curriculum. Journal Club is a 4-semester course. Each semester, it is a joint course with first and second year students together, reviewing literature and learning how to critically assess and review and discuss literature. And we are also somewhat unique in that we have our students in the first year, in the first semester, within a week of arriving on campus, getting into the clinic for observation-related rotations to kind of connect the dots between what's happening in the classroom and what you'll be doing as practicing professionals. The spring of year one is sort of the heaviest didactic load, where you'll have a continuation of the foundations course, which is a 3-credit course, 90 minutes 2 times a week. I continue to teach the foundations course. The MedGen 2 allows you for more complete and more specific discussion in the different practice areas and the different conditions that are relevant across those practice areas. We also have an ethical, legal issues in human genetics course that's now been expanded to 2 credits, had previously been 1 credit and spans the entire semester, taught by faculty on the nuances of ethical implications for what we do as genetic counselors. We then have the psychosocial practicum, which is also a joint course between first and second year students, where a deeper dive into the psychosocial aspects of genetic counseling takes place, dealing with a more in-depth coverage of some of the subjects as well. In addition, we have the epidemiology and population genetics course and the fundamentals of in epidemiology courses, which give you, as the titles might suggest, fundamental knowledge about epidemiology, statistics, using different statistics programs, looking at population studies as well. We also merge that with a trip to the genetics, or I should say to the state screening lab for newborn screening. That's also in Austin. So we actually have a field trip associated with that. Then as you enter into thesis 1, this is where you have developed a committee for a thesis project that was facilitated by what you learned in the research methods course, but now you start to apply and develop your project. There is a feasibility review component where our committee in research reviews projects that are suggested to make sure that you will be successful and to launch you into the development of a project that either requires IRB approval or not. It may have a prior approval. There may be quantitative, qualitative, or mixed method types of studies you'll do. And again, our program is a thesis-based program where you will get a chance to defend your thesis, and I'll talk more about that momentarily. Journal Club continues in the spring, and each student in that class will present a journal article, and that happens throughout the time of the 4 semesters you are here. In Clinical Practicum 2, this is also a 5-week rotation. The first semester rotations are also 5 weeks. You begin to do the application of your skills that you've learned in the classroom and observed in the clinic, such that by the time you finish your 3rd 5-week rotation in the spring, you will have the ability and the skills to do complete sessions under supervision, preparing you well for the summer. And I'll talk more about the summer momentarily. At the very end of the semester, there's a 1-credit, 1-week-long course in laboratory facilitated by faculty at the Baylor Genetics Laboratory, as well as faculty within the Department of Molecular and Human Genetics and the Genetic Counseling Division. As you progress towards the summer, there is a 5-week clinical practicum rotation, basically a full-time 40 hours a week for 5 weeks at a setting of your choosing, either within the TMC with our clinical rotation sites. We also do some reciprocal with the UT Houston program, where there are site opportunities there. Other sites across the state, San Antonio is also one of the sites where students may choose to go, or across the country or internationally. And I'll talk more about that momentarily as well. The courses in the fall, when you return after your summer break, are Advanced Genetic Counseling 1, a 2-credit course where we obviously take a deeper dive in more advanced counseling. We also prepare you for interviewing, for CV writing, and preparing for the career that you've chosen. Thesis 2, by now you've got your approved projects and you are now beginning to assess the data or doing interviews, transcribing interviews, completing the collection, and beginning to develop what would be a manuscript, which is part of the graduation requirement. A manuscript that's suitable for publication is part of your completion of that project under the guidance of your thesis committee, with a chair and committee members that have expertise and knowledge related to the project that you are pursuing. Journal Club 3 is a continuation of what I've described previously within Journal Club. And then Health Behavioral Counseling 2 is sort of an application of what you've learned in the clinic and doing more specific counseling related techniques, including shared decision making and use and applicability of the motivational interviewing and other counseling techniques. And then lastly, the clinical practicum, where you're now doing full sessions routinely under supervision, 2 days a week. Is usually the case. You're following up on results, beginning to do note writing and other skills that will serve you well when you prepare to graduate. In the last of our 4 semesters, you really are now getting ready for the skills that you'll need across the continuum of care that you might provide. We have training that allows you to be an expert in many different areas, to have the skills to go into industry, to go into laboratory, to go into clinical settings, prenatal, pediatric, specialty clinic. We anticipate that we want you to be prepared for the board exam and prepared for whatever job suits your fancy, so to speak. Thesis 3 is the completion of your thesis project, the scheduling of your defense, where there's an oral defense and a written review of the manuscript that is suitable for publication. And under the guidance of the team we have here, our students have been very successful and produced some wonderful research that is publication worthy. The final psychosocial, again, with first and second year students, doing some of the more advanced skills and preparation for going out into the real world. The final journal club and the last clinical practicum, that is basically 7 weeks of practicum. And then there's an elective that is for 4 weeks at the end of the semester. And then you don't have clinicals for the last 4 weeks because that's when you are getting ready for your thesis defense. So based on feedback we've gotten from prior students, we've made some adjustments to the length and duration of the clinical practicums, and that's reflected in that curriculum. We have multiple sites where clinical rotations take place. This is a smattering of what those sites are. I also want to point out Texas Children's Hospital is one of the premier children's hospitals across the country, as is the case in this slide here, recognizing the most recent rankings for specialty areas in practice. 10 of the specialty areas were in the top 10 in the country, with several of them including the pediatric cardiology, nephrology, pulmonology, and lung surgery being number 1 in the country. And then not far behind, neurology, diabetes, neonatology. One note, there is not currently a ranking for genetics programs. If there were, I'm sure we would rank very highly there. But many of our faculty work in many of these different departments, and you'll have opportunity to rotate through many of those different areas during your training here. Oops, I don't want to skip the students. This is what it's all about, the training of our students. We currently have 9 students in the first year class, 9 students in the second year class. You'll have an opportunity to meet some of them in the breakout rooms after I conclude the conversations that we're having right now. As you'll see, they're from a variety of locations, both within Texas and across the country. The rotation sites, these stars reflect many, but not all of the clinical rotations. And you'll notice there are many or some that are outside the country. New Zealand is one of the places that one of our students, who also happens to be present for the breakout rooms, attended this past summer. We have a current student who's interested in going to Chile. We had arrangements to go to Cuba, but COVID kind of put the kibosh on that. We had a student go to Scotland. If you are interested in a local or a distant rotation, Salma Nassef will work her magic with you in identifying rotations and working with you, and the program leadership will work with you to find rotations that would be of interest to you. We take it very seriously that students who come to Baylor are allowed the opportunity to engage with mentors and learn from their mentors. So we assign a faculty member and a second-year student to all first-year students. And we have a variety of events to foster mentorship and engagement. That includes some of the things we've done in the past, including a scavenger hunt, volunteering at a food bank, coordinating activities with Rare Disease Day, just to name a few. And also more recently, the Marfan Walk, which is the picture you see here, in March of this year. And we are soon to have a bingo night next month, where faculty and students will have a chance to relax, have dinner, and socialize through that mentorship process. Some of the activities that our students engage in include what I mentioned earlier, the newborn screening lab trip to Austin. That includes information on the Texas Birth Defects Registry and the Cancer Registry that are part of the information that is brought to bear for all of the students, first-year students. We also have traditionally done a legislative lobby day in coordination with the March of Dimes. Texas is a little unusual in that they have a legislative session every other year. And when they've had the legislative session, we've brought our first, and this year for the first time, our second-year students to engage with advocacy and legislative advocacy to facilitate some of the skills that you might not get at other programs. We also have the Evenings with Genetics, which is a community outreach and engagement with faculty and individuals within the broader community to learn about different roles of genetics within healthcare and how genetics and genetic counselors engage. Our students have the option to attend that as supplemental activities. We also have recruitment events where students and or faculty may go out into the community, into the high schools, middle schools. We have affiliations with some of the local middle schools and high schools, and a project called the Saturday Morning with Scientists, for example, where students in middle school will be putting together posters, and students in our program and faculty in our program may serve as mentors to those individuals on Saturdays when they present their information and ask for feedback on their posters before they go to the county and or state level competitions for the research that they may be doing. We also have Genetic Counselor Awareness Day. That will be November 9th this year. Traditionally, we have student engagement and activities there. We also, through the fees that you pay as part of your matriculation here at Baylor, that also helps to offset costs for the NSGC annual conference, where students attend in the fall of their second year. And that gives them an opportunity to engage with their future peers and even potentially do interviews with potential employers as well. And then there's also the Texas Society of Genetic Counselors, TSGC, annual conference. First and second year students are invited to attend that, and we pay for their registration. Next year, it's going to be in Houston, so it will allow for individuals to attend locally for both our first and second year students. One thing that I think is a strength of our program is the research that our students are doing. And this is an example of many of the different projects that have been published in peer-reviewed literature, Journal of Genetic Counseling and other respected journals. Also a call out to Lisa Saba, one of our alumni. She actually was just the recipient of the best student publication through the NSGC. We just learned that last week or the week before for her work looking at prenatal genetic counseling practices and recommendations of cancer genetic counseling for patients that were not referred for cancer-related reasons and were seen in a prenatal setting. And several other very important aspects of research published. So it's not just a thesis project that sits on a shelf. There's actually work that's being disseminated amongst your colleagues. Other differentiators for our program, the Variant Interpretation and Counseling course, which I didn't talk much about with regard to the fall of year one. That is a course that allows you to learn about the curation process and variant categorization. How is that done? What are the tools that you might need as a counselor working in practice or interpreting laboratory results when something is a variant of uncertain significance? How did they come to that conclusion? What are the metrics and indices, and becoming well versed in that language and in that process? Certainly working with the Baylor Genetics Lab, the Undiagnosed Disease Network, the UDN. We are a site here where research opportunities exist, and the large faculty of PhD and MD geneticists, as well as the largest, if not one of the largest, academic genetic counseling divisions across the world, if you will. There are certainly a breadth and depth of clinical placements that are difficult to compete with any other program in existence. We're currently the least expensive private genetic counseling program of all those that are private universities and institutions. We have an opportunity for a partial scholarship in the second year for tuition remission for some students who choose to apply and are accepted for a postgraduate research year, a fellowship. Be happy to talk more about that offline as well. And then we've recently brought on a partial scholarship that all applicants who are invited for interviews would be eligible for that if they should match with us. Basically, there's if someone is invited for an interview, you can rank in the scholarship track or in the non-scholarship track. And more details for that can be shared when we're in the breakout rooms in a few moments as well. So if we've now got you piqued your interest, if you will, with regard to our program, how is it that you would be assessed, evaluated, and what's the application admission process? We've recently, in working with the NMS, which all programs work with the NMS, the National Matching Service, basically what that means is all individuals applying to any of the 60 now genetic counseling programs across the country must register with the match, and you can start registering now. It's a one-time registration fee of I believe it's $100, and that allows you to apply to one or all 60 programs with an NMS match. You will still have to pay fees for the application process, and that varies from one program to the next. The NMS rank list that we generate and that individuals, you as applicants to any of the programs you've interviewed at, can be submitted as early as March 27th of 2024. And then less than a month later, all rank lists must be finalized and submitted, both from the program side and from the applicant side, by April 9th. And then less than 2 weeks later, 8 days later, there is the match results, the release day, if you will, match day on April 17th. And then for any slots that aren't filled and any applicants that have interviewed but had not matched, there is a post-match window where you can reach out to a program that has an open slot and potentially gain entrance into a program through that process if you didn't match and there are available slots. The NMS match website is provided here as well. So for our program, you are required to have graduated from an accredited four-year university. Ultimately, we require your transcripts be sent, unofficial transcripts, as part of the application process. If you are invited for an interview, we would ask for official transcripts at that time, and those would be required for the matriculation if you happen to match here as well. A minimum GPA of 3.0. We do not require GRE scores. Obviously, some programs do, but we have chosen not to require that for the last 3 years. We do ask for 2 letters of recommendation, and we ask for a personal statement, and there are some additional questions that we ask you to reply to as part of the application process. A requirement for our program is some type of advocacy experience, and that can be in a variety of settings, whether that be a crisis hotline, bereavement counseling, Planned Parenthood, Special Olympics. This is not an exhaustive list, and if there are any questions you would have about that, you can certainly reach out to the program, reach out to us. If you have questions about what would meet that requirement, if you will. And then you include a CV, a resume as part of the application. If you are going to be a successful applicant, there are some things you can do that will help you reach that point. Meet with a genetic counselor virtually or in person. Job shadow to see what it's really like, or do an internship, a GCA. Obviously, those are harder to come by, but certainly opportunities. You may also want to reach out through the National Society of Genetic Counselors web tool, Find a Genetic Counselor. And then you may also gain experiences that will strengthen your application through laboratory or research experience. And as I mentioned, there are some institutions that have a genetic counseling internship. We had one, but more recently have done a career interest workshop as an alternative to a genetic counseling internship, which allows us to actually have more individuals engage with more faculty through that process. We just did that recently. The application window for our program opened on September 1. The window will close on the 11th of December. And whoops, didn't mean to go forward there again. And that will basically be when all applications should be completed. There will be about 4 more days that recommenders can submit their recommendations, but plan on trying to get everything in by the 11th. And that allows us the time that we need to review applications and then make decisions about who are we going to invite for interviews. Those will go out in February. And then the interview dates are listed here beginning March 18th. And we will have 5 interview dates. We will have 8 interviewees per date and a total of 40 interviewers for what will likely be 10 slots in the next upcoming year. We also plan to have a post-match submission visit day, which means we will have put in our submission for the match and will not change it, but will allow individuals who would like to come to campus, and this is not a requirement, a day to visit, and that's tentatively scheduled for April 5th. During the process of interviews, you would meet with myself, with Salma, the Associate Program Director, with the Research Coordinator, Rachel Franciscovich. You'd get an opportunity to do a virtual tour of our campus and facilities, interview with a variety of faculty and current students, get presentations on the curriculum, a review in more detail, financial aid, student services, housing, and make sure you are prepared for the interviews. Do some research, know who you're going to be talking to, find out a little bit about whether that's Baylor or any other place you might be applying and potentially interviewing. The Texas Society of Genetic Counselors has recently offered a NMS scholarship opportunity for individuals who are Black or African American. So that's available to anyone who's applying to a GC program in the state of Texas. Providing our contact information here so that you know how to get a hold of us through our website, through our email, and also the contact information for myself, for Salma,